Hi everyone. This is the neurocognitive disorder due to traumatic brain injury presentation by Caitlin Wenzel and Teresa Vile. Okay, so an overview of this condition. So neurocognitive disorder due to traumatic brain injury occurs when an individual receives some form of head trauma that includes a loss of consciousness, post-traumatic amnesia, disorientation and confusion, or neurological signs. So some examples are war trauma, sports injuries, and car accidents. So symptoms occur immediately following the trauma or immediately after individual regains consciousness. The cognitive presentation is variable and may include difficulties in attention, executive abilities, learning, memory, and may slow the information processing. In more severe cases, ones that include brain contusions, intracranial hemorrhage, or penetrating injury, the neurocognitive defects may include aphasia, neglect, and constructional dyspraxia. So this disorder may be accompanied by disturbances in emotional functioning, which are things such as irritability, easy frustration, tension, anxiety, personality changes, such as disinhibition, suspiciousness, aggression, apathy, physical disturbances, which includes headaches, fatigue, sleep disorders, vertigo, dizziness, or neurological symptoms and signs, which occurs in the most severe cases and includes things such as seizures, visual disturbances, and cranial nerve deficits. And this is a table that shows the differences between mild, moderate, and severe. So as you can see, the characteristics, depending on the time period, is what really differentiates between the mild, moderate, and severe. So neurocognitive symptoms that are associated with mild traumatic brain injury tend to resolve within days to weeks of the injury, with complete resolution within 3 months. Co-occurring symptoms such as depression, irritability, and fatigue tend to resolve in the weeks following the accident with mild traumatic brain injury. Moderate to severe traumatic brain injury, this is with moderate to severe. There are persistent neurocognitive deficits, as well as the possibility of developing neurophysiological, emotional, and behavioral complications. So this includes things like the seizures, photosensitivity, irritability, depression, and fatigue. Persisting major or mild neurocognitive development disorder due to a traumatic brain injury varies by age and the specifics of the injury and cofactors. So the highest prevalence is among individuals who are younger than 4, adolescents, and individuals over the age of 65. The most common reasons for a traumatic brain injury includes falls, motor vehicle accidents, and sports concussions. So please enjoy this 8-minute video that goes through brain injuries and the different lobes and how each lobe that's impacted affects the personality in the individual.
Ability to verbally express themselves, a lack of. So today's podcast deals with the skills and functions associated with the lobes. There is the frontal lobe, the parietal lobe, the temporal lobe, the occipital lobe, and the cerebellum. Associated with the frontal lobe are various controls. It controls certain of our behaviors and certain of our behaviors. And when it's injured, that has certain consequences. changes that are seen when there's an injury to the frontal lobe include problems with sequencing, perseveration, difficulty making decisions. People experience decreased attention, changed personality, problem-solving difficulty, a decrease in their ability to verbally express themselves, a lack of spontaneity, uncontrolled emotions, social and sexual behaviors, decreased initiation and voluntary. The changes that we see when the temporal lobe is in is that people have problem understanding the spoken word. There are problems with selective attention, sexuality changes. A person with a temporal lobe may be found to persistently talk, and often with a temporal lobe injury, we see an increase in aggressive behavior. There are problems identifying objects and categorizing, and there are problems recognizing faces and finding objects. So now let's talk a little bit about the parietal lobe. The parietal lobe is an area of the brain that takes us into sort of a higher level of function. And as we look at the parietal lobe and those changes, we see in patients with traumatic brain injury difficulty naming objects, problems processing their tactile sensations, problems processing and understanding what their fingers are telling them to touch. You see people's academic skill sets fall, and things that they were easily able to do in the workplace or in the academic setting from a cognitive standpoint. There's confusion between the left and the right. You have a loss of hand-eye coordination and a decreased orientation of where our body goes. Often when I see a client who has damage in the occipital lobe, I see issues of vision defects. There's loss of the visual field. There are problems visually locating objects. Importantly, there are problems identifying colors. People can have distorted vision, hallucinations. They can have something called word blindness. There's the inability to perceive the way that objects move. And obviously, there are problems with reading and writing. And there's an overall slowed processing of the way that our brains process visual information. So when we look at the cerebellum, and that's the area here, really at the back and base of the brain, at the top of the spinal column. As we look at the cerebellum and we look at the types of things that our cerebellum does for us each and every day, we see things like the following. We see the control of gross and fine motor coordination. We see all of our voluntary motor coordination. We decide we want to reach out and grab a jar off the shelf. We put our arm out and we do that. It's our cerebellum in action. We have our balance and our equilibrium, the ability to stand up and not fall over, the ability to be able to ride a skateboard, to be able to ride a bicycle, to go for a jog down the block. Our postural and our eye movements, moving our eyes back and forth, up and down, and utilizing our eyes to obtain visual information so that it can be processed. So our brainstem controls so much of what happens in our body. It controls so many of the different functions that allow us to survive as human beings. It is an area of the brain that really we take for granted, and we should be able to take. But when it becomes injured through an accident, or whatever. The brainstem and injuries that flow from it can have horrible consequences. Let's take a look at some of those. When a person has an injury to the brainstem, you see the damage regulation, our ability to hold our body temperature, to keep it at a healthy temperature as opposed to getting too hot or too cold. We can lose the ability with injury to the brainstem, efficient, effective management of our heart rate, or the rate at which we breathe. People with injuries to their brainstem also experience problems with balance and movement. They have problems with swallowing food and liquids, something each of us should be able to take for granted. Brainstem injuries classically can be associated with symptoms of vertigo, the world spins. Often it's uncontrollable and unfixable. There's dizziness and nausea. So we've now had an opportunity to talk about the different lobes of the brain, what the different lobes of the brain control in terms of each of our lives, in terms of all the different aspects of our physical life, of our emotional life, of the way we think, the way we process information, down to issues when we're talking about the brainstem, for example, just how we swallow food, how our body regulates our temperature. When any of the lobes of our brain is damaged, injured, either by an accident, by a driver, by a drug, by a doctor, it is a horrible consequence. It affects our lives in myriad ways.
Okay, so as you can see from this video, there are numerous sections of a brain that can be affected by a traumatic brain injury, and each section kind of impacts the individual differently. So that just elaborates more on what can occur from a traumatic brain injury. Thank you so much for watching the first part of our presentation. You can go ahead and go to section 2 now. Thank you.